Hello, my name is Emily De Oliveira, and I'm a student at Cedar Crest College. I'm here today to talk to you about my evidence-based practice project on the peanut ball and how it relates to the duration of labor. Women go through labor all the time, and it's a very painful process. One school of thought actually theorizes that the incidence of C-section is so high in America because women are electing to have C-sections as opposed to enduring the pain of childbirth. This can't happen. So women's health professionals are constantly looking for ways to make it easier for women to go through childbirth. One of the newest tricks of the trade on the labor floor is the peanut ball, which is pictured here. The peanut ball is actually just a special shape of labor ball, which can be easily placed between the woman's legs to allow the pelvis to open up in a way that the fetus can descend more easily into the pelvis. So my clinical question is, in laboring women, does the use of the birth ball or peanut ball, as opposed to not using the birth ball or peanut ball, reduce the duration of labor? When I looked to the literature, I searched keywords peanut ball, labor, duration of labor, reduced length of labor, and labor ball. I originally did a Google Scholar search, which resulted in thousands of results. So I then searched EBSCOhost, which searched Medline, CINAHL, and the Cochrane databases. And I found the exact opposite, that there were really only 3 studies done on this topic. Many were done on the birth ball as it related to pain, but not many were done on the duration of labor. So it was easier for me to choose three studies. The first study was by Roth et al. It was a randomized controlled trial of 149 women who were having an elective induction at greater than or equal to 39 weeks and also using an epidural. And this study found that in these women, total labor time was significantly reduced for primiparous women, which means women having their first baby, and there was no significant difference in duration of labor for multiparous women or women who've already had a child. The second study I looked at was by Tavani et al. This was also a randomized controlled trial. This time 60 primate women between the ages of 18 and 35 were trialed, and this study found that the mean pain scores were reduced with the use of the peanut ball, but they found no significant change in duration of labor. So this is conflicting evidence compared to the first study. And the third study by Tussie et al., which is really the gold standard of peanut ball research, the purpose was to determine whether use of a peanut ball decreased length of labor and increased the rate of vaginal birth. This was a randomized 2-group controlled study, and this study looked at 198 women in active labor with vertex babies who used an epidural. This study found that women who used the peanut ball demonstrated shorter first stage of labor by 29 minutes and second stage of labor by 11 minutes. Peanut ball use was associated with significantly lower C-section rate. So after reviewing the research, I came up with 3 recommendations for practice change. First recommendation is the use of the peanut ball should be offered to all primiparous women because it is cost-effective, it's non-invasive, it's non-pharmacologic, and it's something that we can easily implement and can be helpful to shorten the duration of labor for them. Recommendation number 2 is the use of the peanut ball should be offered to women who have epidural anesthesia. We all know that once a woman gets an epidural, they are really confined to the bed, and the research has proven that frequent position changes is what facilitates faster labor. So the peanut ball can be used to change their positions frequently. Also, the peanut ball has been found to be helpful in rotating babies who are malpositioned in the pelvis in the occiput posterior, occiput transverse positions. So we could use the peanut ball to assist women in rotating a malpositioned fetus. And recommendation number 3 is the use of the peanut ball should be offered to women who are passively descending, which means these women have become fully dilated before the baby has descended fully into the pelvis. So we allow them to let their body do the work of pushing the baby down with the contractions. If we place the peanut ball between the woman's legs, once they're fully dilated, it really opens the pelvis up and allows the fetus to descend in a faster fashion. So in conclusion, there has been little research done on the use of peanut balls to shorten the duration of labor, and we look forward to more being done as the peanut ball becomes more more easily implemented on the labor floor. We did find that there is some conflicting evidence in favor of the peanut ball and the duration of labor, but most of it was supportive that it does actually shorten the duration, especially in first-time moms. Nurses would be wise to take this research into consideration and change the way they manage their labor patients, because it is not hard to implement on the labor floor. The balls are relatively inexpensive, they're easy to care for, they're easy to use, and they're non-invasive, non-pharmacologic, and make labor easier. Patient satisfaction is a huge thing in nursing right now, and this is one intervention that has been found to make our patients happy. So it's all the more reason to welcome them onto your unit and use them to facilitate the labor process in women. Thank you for listening.